Welcome to Type 1 Diabetes by Seth Hudson. So type 1 diabetes is an autoimmune disease. What do I mean by autoimmune? It means that the body's T cells physically attack the insulin-producing cells in the pancreas. This leads to no energy getting into the cells. So as we all know, insulin is the key that opens up the cells so that we can put sugar, glucose, so that the cells can survive. Because there's no insulin in the blood, the cells in our body begin to starve and start looking for alternative source of energy. One thing to note is with patients with type 1 diabetes is other autoimmune diseases such as hyperthyroidism and hypothyroidism. And this, of course, is the same story. The glands are attacked by our own immune system. So these are some of the signs and symptoms of hypothyroidism and hyperthyroidism. But what's most important to note with type 1 diabetes is diabetes or diabetic ketoacidosis. This is when the body becomes so starved for energy that it actually breaks down the adipose tissue in our bodies for fuel. When this happens, a byproduct of adipose tissue metabolism is ketones. And something you'll see with DKA is ketones in the patient's urine. So what are some lab values that you can look at? One of the big ones is creatinine to see how well the kidneys are functioning. With high levels of sugar in the bloodstream, the body will try to filter it out and excrete it through your urine, which causes inflammation. Another way to monitor your diabetes is through blood glucose monitoring. Lastly, a fancy way to monitor your average glucose over the past 3 months is called an H1C. Now what this does is it takes the average amount of blood cells that have come in contact with glucose, and it's 3 months long because that's the lifespan of a typical red blood cell. Unfortunately, there is no cure for type 1 diabetes. Patients have one of two options. They can get a pancreas transplant and be put on anti-rejection medications for the rest of their life, or they can choose insulin, which is a well sought after solution to type 1 diabetes. Any patient with type 1 diabetes is going to need education. And not just the patient, but it's important to have the families involved as well. Things you need to educate on is when to administer insulin, how to administer insulin, and the signs and symptoms of hyper and hypoglycemia. Here are some of the signs and symptoms of hypoglycemia. Here also are the signs and symptoms of hyperglycemia. So to treat this condition, there are many different types of insulin out there. One, and the more favorable type of insulin would be Humalog or Novolog. And these are fast-acting insulins that are usually administered 15 minutes before meals. But that's one of the pharmaceutical ways. A non-pharmaceutical way is to monitor your diet. But both the pharmaceutical and the non-pharmaceutical treatments are sought after as well. You want to be able to have a balanced diet and be able to count your carbs and, again, understand when you had too much with hyperglycemia or too little with hypoglycemia. Fuck.